so long. I have wandered through the
I do love a little good Jackson Brown. Dr. My Eyes, indeed. Our next guest, Paul Seegert, has spent a lot of time thinking about healthcare, how it's broken in this country, how it's continuing to break, and maybe we'll be able to provide more solutions for us. He's a managing partner at a health benefits consulting firm, and he has been talking and writing about some of the breaking points in our healthcare industry, why we're paying so much for healthcare. Should we be or should we be not paying as much as we are? Some actionable steps specifically for employers on this. And I asked him on the show because of a story I saw September 6th about how CVS is planning to buy the home healthcare giant Signify Health for $8 billion. Now, remember, CVS we think about as a store, a pharmacy. To some extent, we're captive. If you're a state employee in Connecticut, you have no choice but to go to Caremark. Forget about those local independents that you used to go to. You can only fill your prescriptions at CVS. So they have been accumulating a lot of money. But what they are now trying to do, and what they apparently will be doing, is acquiring an in-home healthcare company, in addition to the fact that we also know that CVS is a company that also is very big in the pharmaceutical benefit space. So in other words, what's happening with CVS, just as an example, is they're selling us drugs at whatever it is, quote, their cost and profit is. They are creating a situation where they can pay less for the drug and therefore enhance their profit because of their pharma benefit role in all of this. And now it looks like they also want to provide actual healthcare services to us on the other end, including I am seeing wanting to be involved with healthcare providers. In other words, actual internal medicine providers. So this sort of vertical integration of one healthcare company provides a lot of dangers for consumers in the way of monopoly and money and pricing. Joining us now is Paul Seegert to talk about a lot of this. Paul, welcome to the show. 203-333-9422 if you'd like to call in or be part of the conversation. Hi, Paul. Welcome to the show today. Hello.
Good morning. Thank you for having me.
So, Paul, tell me a little bit. I just want to focus a little bit on CVS because it's such a known brand to us. Tell me a little bit about what CVS is planning to do and why.
Well, you said the words vertical integration. That's exactly what we're seeing. They have everything that you described a minute ago. They also purchased Aetna, a really large health insurer. So with the goal of really controlling everything involved in someone's healthcare experience, or being able to provide it all. The challenge that I see in healthcare in our country is that as we consolidate, prices go up, they don't go down, like they might in other industries. The efficiencies that are oftentimes gained don't, historically at least, have not resulted in lower cost or higher quality for the consumer. And we're seeing not just CVS, Aetna, CVS, Caremark, Aetna, and that conglomerate doing this, but we're seeing others. United has Optum, and they've announced a partnership with Walmart to put primary care in their stores, starting in the Southeast. You've got Walgreens building a couple hundred primary care facilities. You've got Amazon that just bought First Medical. We're in kind of an arms race, I would say, to control primary care, which this is the new phase of it. It started with hospitals buying up all the primary care doctors' practices.
Yes.
And really squashing them, or creating an environment where it was very difficult for them to remain independent and be profitable. And when we saw that happen, and you really dug into it, the reason was if you control primary care, you control where the real money gets made.
Yeah, the pipeline to all the drugs.
Traffic controller.
Yeah, exactly.
To drugs, to specialties, to surgeries, to in-hospital services. So you now own what you take primary care docs, you turn them into salespeople in a way, because you create rules as to where they can refer a patient.
I know. It's gross.
It's an incredible thing that we're watching.
It's unbelievable. I will tell you, Paul Seegert, and you know what else is a crime about this is very often the primary care doctors are the lowest on the totem pole in terms of their own salary and benefits in the world of the medical profession. It's disgusting.
Without question.
What are we doing? Why are we doing this? Why are we demeaning such an esteemed profession? And why are we allowing all of this vertical integration in a capitalist competitive society? I mean, hello, is somebody knocking on an antitrust door? What's going on?
I hope we'll at least have that conversation, because if you look at what happened with insurers, we're down to this oligopoly of 4 or 5 big insurers that blanket the whole country.
Yep.
And you can absolutely look at the report card we've created there and say, well, in the last 12 years, deductibles have grown 87%, premiums more than that, and 100 million insured Americans hold medical debt. So that certainly hasn't worked out well for the consumer. It hasn't worked out well for employers, who are spending a lot more each year to provide less coverage to their people.
That's right.
We've got a lot to work on here. And I think part of the problem is we don't have a free market, really, in healthcare.
We don't.
Nobody knows what a drug actually costs. No one can go to when you have a planned procedure, you call a provider, a surgery group, whoever it might be. Hey, what is this going to cost? That's not an easy answer, because they have maybe 150 prices for that procedure. So we have a lot of work to do in the transparency front. And when we've tried to do it, the industry has pushed back very effectively. We're at 0.5% compliance across the 3 largest hospital chains on the transparency rule that they're supposed to be following today.
So, Paul Seegert, you're somebody who thinks about this. You're in this space. What are the 1 or 2 or 3 top changes that you think, if they happened, would get us in a better direction? And let me ask you this at the same question. Is the new proposal to allow Medicare to negotiate drug prescription prices while putting a cap on out-of-pocket for consumers, on the whole, is that a good thing, or is that going to unleash the law of unintended consequences and further distort the market? What's going to happen with that?
Yeah, unfortunately, I see more likelihood for the second option there. Part of the problem is that we don't have a free market, we don't have transparency. If people ask me that question, my first answer is, if we could fix it in one word, it would be transparency, so that consumers can consume with good information, which we don't have right now. And so we need to have that. And without it, if you can't create a health plan where an employee or a member in that health plan isn't able to get rewarded for consuming well, and doesn't even know what things cost, and there's no correlation between a copay and a deductible and their share of cost and the actual cost of care, then we're not going to make a lot of progress. And what I see, the other issue is that with that is different payers are treated very differently. So when you look at RAND just came out with a study a few weeks ago. They looked at 4,000 hospitals, and the data from the 4,000 hospitals confirms something that we've been aware of for a long time. Employer plans pay a lot more for the same service at the same facility as compared to other payers. And so what happened there historically was Medicare's rates maybe don't cover the full cost.
That's
Medicaid's rates maybe don't cover the full cost.
We know
so
this.
These hospitals might need 120 to 140% of what they collect. They tolerate that because they can turn around to the employer plan and charge them. The national average is 224% of what those other payers pay, although I've seen it much higher. So we've distorted this, and these employer plans are actually subsidizing these government payers.
That's right.
And the numbers in the employer plans is going down. So it's declining because smaller employers are getting squeezed out of the market. It's becoming unaffordable, and more people go over to the government payer side. So then the employers that are left, their prices have to go up more quickly to compensate. So we've created a problem there when it comes to hospitals, surgeries, non-prescription procedures. Now look at the prescriptions. My fear is we might create the same thing. If you have Medicare saying we're going to pay less for these drugs.
I hear you.
But the law doesn't. You see what I'm saying?
Yes.
We're going to squeeze this balloon and we're going to push it over to employer plans.
I do see what you're saying.
It could have a really negative impact, because you can be sure that the industry isn't going to sit back and say, no problem, we're happy to make 3, 4, 5% less revenue next year, or whatever that number is.
So let's talk about this, Paul Seegert. So let's talk about this, because let's assume that we're not socialists. I'm certainly not a socialist philosophically. And let's assume that we all believe that a prosperous America is usually one driven by the human need for some profit in an enterprise. We understand that. But how do we reconcile that? And should we allow, for example, for-profit hospitals? Let's just start with a hospital. Should we allow hospitals to be for-profit? Some states don't allow them. Should we allow them as a matter of policy?
I think we should, but we should require transparency.
Okay.
So right now you have this for-profit model in most areas, or in lots of areas at least, but no one actually knows. It's still not transparent in any real kind of a way what this negotiation that goes on between health plans and hospitals. That should all be transparent. I was looking at a health plan in Texas. It could be anywhere. And it was a Blue Cross Blue Shield of Texas, but it could be any of the 4 or 5 big brands that we're all familiar with. You could get an MRI within 25 miles of the headquarters of this company, and you would pay a $100 copay because that's what the health plan said you had to pay. They were all in network, all contracted up with Blue Cross Blue Shield in this case. What you didn't know as a consumer was the low-cost facility would turn around and bill the health plan $700, according to the contract that had been negotiated between the provider and the insurer. The high-cost facility would bill the plan $7,000, also negotiated and agreed to by the health insurer. So you have this tenfold range within 25 miles. That's all invisible to the consumer. I think if we all saw that and it had to be published and transparent in a real, usable way, and if the consumer was rewarded, maybe their $100 copay would be $10 if they went to the more efficient facility.
Exactly. In other words, tell us what to do in making healthcare choices. I hear you. Right.
Yes. Yeah. Give consumers real consumption information.
You know,
How
it's
is it we
interesting.
can go on our phone and get it so easily for a TV.
You're right.
And I can't get it for these things.
No,
The
you can't
technology
because
exists,
there's a
the
big
information is
interest.
out there.
There's too much money there.
That's right.
They don't want you to know.
Exactly right.
My husband had to get an MRI, and for a lot of good reasons, he was advised to get an open MRI. But there was only one place that did an open MRI. It's White Plains Hospital, 45 minutes from where we live. He called. He got the insurance. They okayed it. They approved it. Blah 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 blah. Then they hit us with a $6,700 bill. And now they argue that we should pay it. And the insurance company will cover like $4,000 of it or whatever, and they want the difference. And Bill is like, you didn't tell me. What are you talking about? Right. You just told me that it was approved. You didn't tell me you were going to then bill me. So we're having a big fight with them.
Yeah, as you should. As you should. And if you fight hard enough, you'll likely win. But it shouldn't have to be that.
No, it shouldn't. It's aggravating.
It should be that you know what it cost before, and it shouldn't be that difficult to determine what it cost before. It's just complicated by design. Obviously, this thing that used to be 5% of our economy in 50 years has become a fifth or whatever.
Yeah, it's incredible.
So there's a ton of hands in this pot.
There are.
But where government has a role, I'm a free market person. Government has a role. We need common sense requirements around transparency and access to information, and we can solve this. And some employers already are, one at a time. But that's a slow process.
CVS is not one of them. Caremark is not one of them. I can tell you that right now. Not. Definitely not.
No.
Not one of them.
No.
So, and because, so the argument would be, from a policy point of view, that because everybody has a stake in our health care, it isn't an average widget. It is something else. That if you're going to reject this idea that government should control everything for a lot of good reasons, including the fact they won't do it well, then at the very least you should be entitled to demand from the private marketplace in exchange for their right to make a profit that they tell us our choices.
Right, and give you good information. I mean, that's consumer protection, which is that's the job of the government, certainly. And I think common sense regulation could result in that. Lobbying is powerful. So when will this happen? Boy, I'm not super optimistic,
it's
which is why I work with employers one at a time.
Well, it's surprising to me, Paul Seegert, and I know Mark Cuban has just started something, but it's surprising to me that somebody hasn't come up with a brilliant app for this.
Oh, we have some of those. It's just getting the information into the app. Those that own the information are, of course, very hesitant to reveal it. This is the same reason we don't have or share it. The same reason we have very low and really inconsequential compliance with the hospital transparency rule. The hospitals don't want to broadcast. They don't want to be subject to free market forces and share with the world that they have more than 150 prices for every procedure they perform on average, and that different payers pay wildly different amounts. They don't want to share that, but we need them to. We need them to.
Okay.
Or we don't stand a chance.
Thank you, Paul Seegert. I speak with politicians at various times on the Lisa Wexler Show, and I am going to remind them of this as a public policy that personally I don't see should be partisan in any way. Consumer protection is the least partisan of all things, and I would hope that people will get on board. Thank you very much, Paul Seegert, for being with us today.
Thanks for having me. Have a great day.
Thank you. We'll be right back with more of the Lisa Wexler Show.